Welcome back. Now, data shows that children exposed to violence at home are more likely to adopt aggressive behaviour themselves. These children manifest continued aggression throughout their lives as part of a cycle of intergenerational violence. But it is not just the presence of violence that creates the cycle. It is also the absence of warm, secure relationships with healthy adult role models. While violence is a global phenomenon impacting all families, it remains a particularly persistent problem in South Africa. SAPPIN hosted its inaugural Families Indaba, and to share more on how the conference is helping families in South Africa, we're joined by Katharine Frost from SAPPIN. Katharine, good morning. Welcome to Morning Live.
Thank you so much for having me, Lebo.
Can you briefly tell us more about the inaugural Families Indaba and what was discussed at the conference?
Sure. I think to start, I'd like to tell you a bit about SAPPIN first. We're a network of non-profit organisations across the country, and all of us have parenting programs embedded in our services.
Right.
So what we wanted to do is to really highlight what SAPPIN does, the importance of parenting, the link with parenting and violence. And we thought the best way to do that would be to host a 2-day Indaba, to invite stakeholders in the parenting sector, stakeholders from government, business, funders, and other non-profit organizations to really advocate for the power of supporting parents in the link in preventing violence.
What are some of the major issues at the Indaba?
Well, I think what we're really wanting to do is to hold government to account. Our government has put policies in place that really advocate for parenting support, but 98% of social welfare services, including parenting support, is held by non-governmental organizations.
Right.
So we're wanting to really partner with government as well as business so that we have a far wider reach. We were speaking to them and other stakeholders about how we can partner together to really raise the profile of parenting and parenting support in this country.
And what is government's response to what you had to raise?
I think there's a lot of interest. I think what we really need to do is help implement. Implementation really is the struggle, and we're looking for partnerships, because if we can partner together, both in the Department of Health, the Departments of Social Development, really where parents are interfacing with other parents, then we have an opportunity to provide support for them at clinics, hospitals, at schools, at churches, waiting in queues to get grants. All of this provides opportunities to put forward the message of parenting is hard everywhere. Everyone needs support. Everyone's got questions. And the answers are available through this network of non-profits.
Did you come to address issues of what challenges parents may be facing themselves, as individuals? Before you're a parent, you're a human being with your own trauma, with your own challenges.
I think this is what is so difficult and challenging about parenting. We default to parent the way that we ourselves were parented, for better or worse. And what we are really trying to do is to help parents, I think, heal with what happened to them in the past and give an opportunity to do things differently, as well as to hold on to those parts of their parenting experience that they're wanting to hold on to. Everyone wants to hold on parts, and everyone, I think, wants to let go of parts that were damaging for them. Parents need to heal first if they're really wanting to affect change for the next generation.
And how much are parents willing to face those traumas? Because you can't heal from something you don't acknowledge.
It's a very good question. I think a lot of people feel that damage even if they can't acknowledge it. And I really want to invite parents to speak out. It doesn't even need to necessarily be at a non-profit. I think it can be in church groups, with other parents. And there are resources available through some of the exciting projects that SAPPIN is foregrounding.
Talk to us about some of the services offered by these organizations that are part of SAPPIN.
So what's complicated about it, Lebo, is that we're a network of different non-profits across the country. Each one of these organizations, caters to the needs of their particular community. We've got network partners in George, in rural areas of KwaZulu-Natal, in the Western Cape, quite a lot in Gauteng. And so each of these organizations really fits to the context that they find themselves. But there are parenting groups. There are alternatives to corporal punishment. So many parents need that kind of information. And there are opportunities to have one-on-one conversations with other parents as well as groups to really share the parenting experience, because I think there's such power in knowing that you aren't struggling alone.
And how much of the parents know that there's no particular formula? You know, I think the one thing that we also get wrong as parents to say, no, I'm supposed to parent in this particular way because, you know, I was raised in this way. You know, how much of us know that, you know, there's no formula and there's no, you know, medal at the end of parenting?
There is no manual level. I think that's the crazy thing. It's probably the most important job that any of us will ever occupy, but there is no manual. But there are some basic principles. You mentioned that idea of sensitive, responsive, nurturing care. And I think often we forget that our very small people, even the little ones, babies in the first 1,000 days, are acutely sensitive to the quality of how we are with them. So much so that the beginnings of a template of a personality of who they are is formed in what we term the first 1,000 days. From conception until 2 years of age. So parents have so much power, even if there isn't a manual, but there's power in finding something about nurturing responsive care to their little people.
Yeah. So what are some of the key issues that came out of the Indaba?
There's a lot of interest in some of our programs. One particular program is the workplace intervention, which I think is really innovative, where we are talking to business and motivating that business finds opportunities for staff, who are mostly parents, to have parenting support within the workday. And this is a really interesting innovation so that parents don't have to give up more time when time is so little, especially for those working parents. That's one really useful project that came out of the Indaba. Another one is the Parent Line SA, a WhatsApp support group for parents where you can ask questions and get some very basic answers, as well as referrals on where you can access more help.
You know, I read somewhere, I think it was a video that I watched, and this guy says all his staff are parents, you know, so parents they're all moms and they can multitask. You know, he gets so much done because these parents, they come in for a couple of hours and then they go home to be mothers, you know, take their kids to school. How much are we talking about the challenges that parents face in including, you know, work and being a parent and being a wife?
A lot of that, and I don't want to fit into the mistake of talking only about mothers, because I think there's a huge, I think we haven't done fathers a good enough service in really highlighting the importance of fathers. At the same time, I think if workplaces support mothers, because we know how critically important this multitasking role is, we support them in their function as parents as well, we're going to get the best out of working mothers if they are held to be supported by their employers. And I think the same is true for fathers. There's incredible research level about the impact on fathers and present fathers in the development of their children, really right from the very beginning. We make the mistake of excluding fathers to our and the next generation's detriment.
All right, Katharine, thank you so much for talking to us. Katharine Frost from the South African Parenting Program Implementers Network, which provides parenting programs.